I'm about to interview Dr. Kang, OBGYN and surgeon at CHA Fertility Center in Korea. If you're from the States or Canada, you know that egg freezing can cost a fortune and take months to even get started. That's why we chose to do it abroad in Korea. So, in this episode, I'm going to unpack those questions that you've been GPT'ing at 2 a.m. so that you can have a good understanding of what egg freezing is really like in Korea before you hop on that plane. Welcome to Bloom Korea. So the first question I want to ask you, this is the one we get most often, is how painful is egg freezing, honestly?
First of all, everyone's experience is different, as we can imagine, but many people tell me that it's not as painful as expected. Daily injections are very small, more like a pinch. And during the stimulation, the main symptom is bloating, similar to PMS.
That's helpful to know because I think most people imagine something way bigger. So it's good to know that you're not completely out of commission. So for somebody who is new to this, can you help me understand in simple terms what egg freezing is and how it works?
Okay, so first of all, women are born with a set number of eggs, that is a finite number. And normally a woman releases one egg per month. That is called ovulation. And as you get older, the number and both the quality of the eggs decrease. When you run out of eggs, that is called menopause. So ideally, we do egg freezing when the number and the quality is still good. That is that we use hormones, daily injections, to stimulate the ovaries and try to grow multiple eggs at one time.
So instead of getting one, you can get many.
Yeah. We then collect those eggs and freeze them. And later on, when you're ready, the eggs can be thawed and fertilized with the future husband's sperm. So that is the main concept.
That makes sense. So in a way, egg freezing buys you time. You get the eggs now at the current quantity and quality, and in the future, you can use it.
Yes, that's correct.
So the next big question is timing. When is the best time for women to freeze their eggs? And for the women out there in their 30s, do they still have a good chance at retrieving good quality eggs?
So the best time is usually in your late 20s to early 30s, when egg quality and quantity both are still relatively high. However, women in their mid to late 30s can still benefit, especially if they're not yet ready to try for pregnancy. The key is to set a realistic expectation. The number and quality may be lower than in the 20s. It can still make a meaningful difference for future family planning.
Let's now talk hormones. A lot of women worry about things like mood swings or weight gain and other side effects. Is this a myth or is this something that we should be expecting?
That's the question pretty much everybody asks.
Oh, okay.
So let's talk about that. Hormones can and will cause some side effects. And like you said, the most common things are bloating, mood changes like PMS. Some women feel emotional or tired, and some gain a little water weight. But most women feel back to normal quickly after the cycle ends, that is, after the egg retrieval.
I see. So during this time, do most women work from what you've seen, or do they stay bedridden?
People work, people do the daily activities, people exercise, do everything they can, but we do not recommend heavy exercise like 2 or 3 days before egg retrieval.
Right, and you don't want the premature ovulation.
We did not want that.
Okay, so let's now get practical. Let's say I hop on the plane today to go to Korea.
Okay.
How much time would I need to do egg freezing?
The procedure begins on day 2 or day 3 of the start of menstrual cycle. And from that point, we start hormone injections daily and cycle monitoring during regular visits. You'll come back to the clinic every 3 or 4 days for blood tests and ultrasounds so we can check how the follicles are growing, how big they are, and how many of them. And by around day 10 to 12, the eggs usually reach the right size. Then we schedule a egg retrieval. And after the retrieval, we recommend resting for 1 or 2 days. So that may take about 15 to 16 days, and flying to South Korea and back takes about 2 or 3 days. So that makes up to about 3 weeks.
And so if I only have 3 weeks in my budget, it's really important that I am timing myself well to that first day of my menstrual cycle, right? It's always timed to my menstrual cycle, is that correct?
Yeah, so you can take oral contraceptive pills to schedule the period, like delay the period until the flight of coming to Korea.
Right. Oh, so you come off of it the night before or the day of the flight, and then naturally the period will come. Another thing people want to know is how many eggs is enough?
So let's talk about numbers. For patients under the age of 35, we recommend a target number of 15 eggs. That will give approximately 85% chance of a live birth, one healthy child. And for people between the age of 35 and 37, a target number of 20 is needed for an 80% chance of one healthy child. And if the maternal age is over 37, more than 30 eggs are needed for a 75% chance of one healthy child.
What happens after? Do they get degraded over time, or do they stay the same forever?
Once eggs are frozen, they stay the same.
Ooh, that's a relief.
And they stay pretty much the same quality as the day they were frozen.
So another question we often get is, are my eggs safe here? Can you talk to me about safety protocols that are here to just calm that fear?
The key is consistency. The quality of the eggs need to be the same right after freezing and 3 or 4 or 5 years after.
Right.
And CHA Fertility Center has one of the largest freezing facilities in the world. And for each and every sample, they're carefully labeled and tracked. So the eggs are well protected and they're monitored 24 hours a day, temperature and general conditions, everything, and with backup systems in place. So patients should be confident.
And what if women come back after they freeze their eggs and want to take it back with them to their country? Is it possible to ship these eggs outside of Korea?
Under Korean law, exporting frozen eggs is very restricted, and in most cases it is not allowed. And because of this, many patients simply return to Korea to use their frozen eggs, and that is the safest way to use them.
So egg freezing is the first of many steps within the full IVF landscape. Can you break it down for us what the rest of the steps look like?
Like you said, egg freezing is the first step, and later when patients are ready to have a baby or have family planning, then the frozen eggs are thawed and the eggs are then fertilized with the husband's sperm to create the embryos.
Right.
And the embryos grow in the embryology lab for a few days. And then these embryos can be transferred into the uterus. That is, the embryos that survive.
I see.
If an embryo implants successfully and the gestational sac is seen under ultrasound, then we consider that as a pregnancy.
So if you had one piece of advice for women who are feeling a little bit of pressure, but they're kind of sitting on the fence, what kind of advice would you give them?
Number one is don't wait too long if you are thinking about egg freezing. The simple way to put it is to regard egg freezing as an insurance. And we freeze the eggs at a certain point and the eggs are kept at the age you froze them. They don't continue aging with you.
The last question is, what do you think sets Korea and CHA Fertility Center apart from others in egg freezing and its success rates?
Korea first of all, has a strong reputation in the fertility field with very good success rates. And at CHA Hospital, we see a large number of patients every year. So our doctors and lab teams have a lot of experience and confidence. The process here is usually faster and the cost is lower. That's a big plus for most people. And one of the other things is that it's all done in one building.
And that really resonates with me. Personally, it took me about 6 months to get referred to a specialist to even get my fertility blood levels checked out. Back in North America, this is a common issue. Plus, once you get in the ring, it also takes a lot of time to go through the different tests, and you have to go to different facilities, let alone how expensive it is. And for anybody who is considering freezing their eggs, Korea is definitely a viable choice.